Kent Medway Medical School is very excited about the opening of this building at Canterbury Christchurch University. Our students will have the opportunity in this building to interact with engineering, sports, health and biosciences students. Kent Medway Medical School students will have the opportunity to take advantage of three important facilities in this building. The first of those is the Anatomy Learning Centre, the first cadaveric anatomy facility of its kind in Kent Medway. The High Fidelity Simulation Suite, where our students will learn in a high fidelity simulated environment alongside many other healthcare students. And the Collaborative Lecture Theatre, where our students will have a really innovative and high technology experience of learning in what used to be a very formal and traditional learning environment. So this is the communal learning space of the Anatomy Learning Centre. In this space, our students will learn in small groups about some of the fundamental anatomical knowledge that they need, which will form the foundations of all of their professional knowledge for the rest of their careers. That means that our students will be able to learn using dissection, prosection, and we're very excited that as a modern anatomy learning centre, we've been able to integrate medical imaging using techniques such as X-rays, CTs and ultrasound into the learning that happens here. This is a high-fidelity mannequin of a lady in the later stages of pregnancy. It's computer controlled from the computer here, and on it you can see all of the physiological variables that it might be necessary to set. If you watch carefully, you'll see that her chest goes up and down, and if I feel here at her wrist, she has a pulse. Many other physiological features can be simulated as well. So this is one of our clinical skills rooms in the simulation suite. And in this, we don't use mannequins, we use things like this called part-task trainers. So this is some simulated skin, it's made of plastic, and students are able to learn how to give different sorts of injections going through the skin, through to subcutaneous tissues, through to the muscle. And if you cut this, then students can learn how to suture. A device like this is used to learn how to do cannulation. So in this plastic arm there are veins and students can learn how to put cannulas and needles in, and in the veins we have fake red dye to simulate blood. See, this is what we call a collaborative lecture theatre, and you'll see that rather than serried ranks of seats, what we have done is we've organised the seats around small groups of tables. That means that students can, in the middle of a lecture, work in small groups on material that the lecturer has provided them with.
Hello and welcome to the Kent and Medway Medical School Virtual Open Day. We're here to show you everything you need to know about studying at Kmms. Over the next couple of hours, we'll be chatting to teaching and professional services staff, along with current medical students, to get a taste of what the course has to offer and get a flavour of life here on campus. We just had a brief glimpse there of the new £65 million Verena Holmes building, just one of the state-of-the-art facilities available to students. And whether you've got questions about the course, accommodation, or where best to soak up student life, you can send them in to us via YouTube or Facebook in the live comment section on screen, and we'll get them answered for you. I can see here on the screen in front of me, we've got listeners from Westgate-on-Sea, Leytonstone, London, Chatham, Cornwall, Hampshire, Gravesend and Tunbridge, to name just a few. So we'll be getting all your questions answered for you over the course of the next couple of hours. But if you have any more personal questions regarding your entry requirements, you can send those in separately to admissions@kmms.ac.uk. A final bit of housekeeping, as we're all on the line from various locations due to social distancing. Do bear with us if we encounter any technical gremlins. We'll look to get those sorted as soon as we can. Now, we've got a packed roster this morning, but who better to begin with than the founding dean of the Kent and Medway Medical School, Professor Chris Holland. Professor Holland, let's head over to you to kick things off.
Thank you, Cameron. Good morning, everyone. As you've heard, my name is Chris Holland. I'm the founding dean of Kent and Medway Medical School. I started in the role in 2018, nearly 2 years before we opened. I'm also an intensive care consultant and I practice at Maidstone Hospital. If we can have the slides, please. Thank you. So, I'm the leader of Kent and Medway Medical School. Our undergraduate medicine programme and the medical school itself is the result of a collaboration between two excellent universities, Canterbury Christchurch University and the University of Kent. Both of these universities have excellent teaching and learning skills and experience and expertise. Both are research active, and both have an active focus in health, human sciences, biosciences, as well as many other disciplines that will all contribute to enriching your time at Kenton Medway Medical School and a member of both universities. As a new medical school, we are required to have what's called a contingency school, a partner, if you like. And our partner is Brighton and Sussex Medical School. And that's really excellent for us because Brighton and Sussex Medical School consistently is well evaluated in terms of its student experience. It's geographically close to us, just being in the next county over. And they are also a partnership between two universities, Brighton and Sussex universities. And that's very helpful because these partnership medical schools are quite rare in the United Kingdom. Next slide, please. So when we opened, one of the things that we needed to do was to be very clear and unambiguous about what it was that was going to set Kenton Medway Medical School apart and what was going to make our graduates unique. And we really feel that, of course, whilst we want to have a first-class medical education program for our students, whilst we want to grow and expand the healthcare-related research that happens in both universities and the county, but we really wanted to think long and hard about what it was that would make our graduates fit for the 21st century. And we think that for us, that means being person-centered. A lot of medical schools will also claim to do this, but really, we really wanted to make that part of the vision and the ethos of the school from our outset. It is essential to realize that the 21st century is going to be a time of change. The past 18 months have already demonstrated that change is unavoidable. The pandemic has obviously been
a good day. Excuse my very messy notes, but this is basically the outcome of the consultation that we had with the patient that we saw today. And the patient presented with breathlessness, but not in a typical way, as her outcome with breathlessness was actually due to a problem with her heart. So she had an enlarged heart, and that was causing her breathlessness. So we had the chance to be able to interview her, ask her questions, find out where she was with treatment, and she initially started with a 15% functionality of the heart, and after 2 years of taking a cocktail of drugs, it's now at 51%, which is great news. So now I'm back at the hotel and, done for the day. We'll probably just spend the rest of the afternoon chilling for a little bit and then doing some work. Yay! So thank you for following along with my placement warning. I hope you enjoyed it and that you got something from it. If you have any questions, please feel free to ask.
There you go. We're still trying to sort out those technical difficulties. Do bear with us. Any of you who are just joining now, and we've got a whole array of you joining from across the country. Any of you that are just joining us now, we've got a short video here of the Verena Holmes building, one of the many state-of-the-art facilities you'll be enjoying when you come to KMMS. Here's a short clip.
Kent Medway Medical School is very excited about the opening of this building at Canterbury Christchurch University. Our students will have the opportunity in this building to interact with engineering, sports, health and biosciences students. Kent Medway Medical School students will have the opportunity to take advantage of three important facilities in this building. The first of those is the Anatomy Learning Centre, the first cadaveric anatomy facility of its kind in Kent Medway. The High Fidelity Simulation Suite, where our students will learn in a high fidelity simulated environment alongside many other healthcare students. And the Collaborative Lecture Theatre, where our students will have a really innovative and high technology experience of learning in what used to be a very formal and traditional learning environment. So this is the communal learning space of the Anatomy Learning Centre. In this space, our students will learn in small groups about some of the fundamental anatomical knowledge that they need, which will form the foundations of all of their professional knowledge for the rest of their careers. That means that our students will be able to learn using dissection, prosection, and we're very excited that as a modern anatomy learning centre, we've been able to integrate medical imaging using techniques such as X-rays, CTs and ultrasound into the learning that happens here. This is a high-fidelity mannequin of a lady in the later stages of pregnancy. It's computer controlled from the computer here, and on it you can see all of the physiological variables that it might be necessary to set. If you watch carefully, you'll see that her chest goes up and down, and if I feel here at her wrist, she has a pulse. Many other physiological features can be simulated as well. So this is one of our clinical skills rooms in the simulation suite. And in this, we don't use mannequins, we use things like this called part task trainers. So this is some simulated skin, it's made of plastic, and students are able to learn how to give different sorts of injections going through the skin, through to subcutaneous tissues, through to the muscle. And if you cut this, then students can learn how to suture. A device like this is used to learn how to do cannulation. So in this plastic arm there are veins, and students can learn how to put cannulas and needles in, and in the veins we have fake red dye to simulate blood. See, this is what we call a collaborative lecture theatre, and you'll see that rather than serried ranks of seats, what we have done is we've organised the seats around small groups of tables. That means that students can, in the middle of a lecture, work in small groups on material that the lecturer has provided them with.
Professor Holland back on the line. Professor Holland, apologies for the technical difficulties. Would you like to continue with your presentation?
Yep, thank you very much. Thanks, Cameron. And for those of you that have been paying attention, you'll notice that I've been joined by my PA. As Cameron said, we're working from home today, and this is my 5-year-old daughter who's participating but has promised to be quiet. She's got a bit of a cold, but I do assure you it's not COVID. So just before we encountered that technical hitch, I was talking about the philosophy, the mission statement of the medical school and our culture. And all of those come together in our values. And these values are drawn from the culture and the values and the mission of both of our universities, as well as the core constitution and values of the NHS. And these are really important to us, but I would say that they have become more important to us as time has gone by, as we've opened, and in particular as we've encountered the challenges of the past 18 months, both clinically within the NHS, but in our professional and personal lives as well. There's no question that opening a new medical school involves bravery. To a certain extent, choosing to come to a new medical school is a little bit brave as well, but we feel excited about the prospect and we hope that you will too. I think kindness has become more important over the past 18 months. Everyone's had their own personal journey and has encountered their own personal difficulties. And being kind to each other and recognizing that we don't know the shoes that other people are in has become something that we practice on a daily basis. Respect is very important, and it's part of that person-centeredness of the medical school. It is absolutely essential that we respect our patients' healthcare decisions, and we respect each other and other members of the healthcare team. In working in intensive care over the past 18 months, I've been hugely humbled, not just by the performance of my medical colleagues and my nursing colleagues who practice in intensive care day in, day out, but the fact that people who don't normally work in intensive care have come into environments where they don't normally work and have participated in providing intensive care to some of the most sick people through the pandemic. Passion, well, that's what gets you up in the morning, and we hope that you'll be passionate about coming to Kmms and going on to make a difference in the lives of countless patients. Collaboration is elemental to 21st century healthcare. As an intensive care consultant, I live and breathe collaboration. We've really sought to be innovative in how we've set about creating Kent and Medway Medical School in the programme that you will study on while you're with us. And that innovation, as I say, leads forward into the innovation and the constant adoption of innovation that you'll have to have in your professional practices through the duration of your professional careers. And curiosity is definitely, again, something which has been exemplified. As an intensive care consultant, it's been one of the most interesting and professionally challenging, but also stimulating experiences of my life to be at the front line, at the cold face of the healthcare system, managing people who have a disease that we've literally never seen before. And curiosity literally drove a lot of the early decisions that we had to make around how best to care for patients with COVID, and has resulted in amazing things like the deployment of completely novel treatments and the absolutely incredible achievement of having a vaccine and a global vaccination program in less than 18 months. Next slide, please. So our mission outside is then what comes out of our philosophy, our vision and our values. As one of 5 new medical schools in the United Kingdom, in particular in England, one of the things that we are absolutely required to do is what's called widen participation in medicine. That means that fundamentally we want our student demographic to include people who wouldn't otherwise have an opportunity to study medicine. Our medical school is in Kent and Medway because we, as well as the other areas where Kent and Medway, as well as the other areas where the new medical schools have been placed, have significant health inequalities. We are in under-doctored areas, and we have areas of extreme socioeconomic deprivation, as well as other forms of health inequality and deprivation. However, in the context of that, we are, of course, clear that your education won't suffer because of that context. And that means that we're required to provide evidence to our universities, our regulators and the General Medical Council that our placements and the whole of our educational programme is of a high quality. We are required to coin a phrase, level up. And it's true that historically in medicine and in medical schools, other specialties such as, for example, surgery or physicianing or medicine in the physicianly sense of the word have been perceived as having higher prestige to specialties like primary care, mental health and acute medicine. And as I've alluded to, whilst you will of course achieve the core learning outcomes that every medical school student will achieve, you'll also have the opportunity to experience an innovative curriculum. Next slide, please. So, how did we do in terms of we're now coming to the end of our first year? And we were having these exact conversations this time a year ago in the context of a lockdown and a pandemic. And here's an opportunity to have a quick glimpse of our first cohort of students. So that's always a really incredible video for us to watch from the team, because those people that you've just seen are actual human beings to us. But I hope you got a flavour there of the incredible diversity of age, of gender, of ethnicity, and all of the other things that you can read into how someone takes a picture. But every single one of those people is a human being and an individual, and they have their own life story. And they chose last year to come to Kenton Medway Medical School in the context of a pandemic. So what did they go through? We opened, that is what we call our pioneer group of medical students. They've had a very interesting year, and so have we all. So as I've mentioned a couple of times, I'm an intensive care consultant. There's a picture of me doing a ward round in what we call the red zone of intensive care in all my PPE. Beside me there in the purple top is Dr. Anna Ramito. She's a GP, and she has been practicing during the pandemic as well. And general practice, for any of you that have any contact with general practice, you'll know general practice has moved 90% or so online and virtual. So virtual consultations, telephone consultations, video consultations have become the norm, and will certainly not move away from that in any great deal for some time to come, if ever. In the midst of all of that, as I've mentioned, we needed to make sure that our program maintained the quality and standards expected of us, and we've had a couple of virtual visits from the General Medical Council, our regulator and the regulator of the entire profession of medicine in the United Kingdom. And our students have gone on placements. We're very proud that we've achieved our planned 6 weeks of primary care placements in the community throughout the whole year. And again, that's given our students to see how healthcare has responded to the NHS. It's given them an anchor to remind them what it's all about, because a lot of their other teaching has been online. But as well as that, that is more than any other medical school program, even in normal times. That's more placement time in first year than any other school would provide. We've continued to recruit and grow our team. That picture of the team was taken about 2 days before the country went into lockdown last March. And since then, the team has more than doubled in size in terms of headcount. So we've got people on our team who've never worked in a Kmms office because they've been working from home. And I'm really proud of my team for having come together and coalesced around the culture and values that I mentioned. We've started to make our first research appointments, and we can continue to raise money for philanthropic funding. And I'm really, really proud that at Kenton Medway Medical School, we have on a pro rata basis, we have more scholarships available to our students than any other school of similar size or age. Next slide, please. So I don't run the medical school entirely by myself. I've talked about teamwork and collaboration and our philosophy and values. I'm very ably supported and entirely reliant upon my senior leadership team, and they include Kat Taylor, who's one of our school administration managers, who's also, if you like, buddied up with Carl Grice, who's the other 50% of that role. In the other 50% of their individual roles, Kat is our project manager, because opening a school is an ongoing project through to 2025, and Carl in particular supports the quality assurance process of our program and our school. I've mentioned Dr. Anna Ramito, who's a general practitioner, and she's the undergraduate program director and my deputy for when I'm unavailable or doing other things. Dr. Philip Chan is our head of admissions, and you're going to meet him later on today as well. And Philip was previously a vascular surgeon in Sheffield, very strongly involved with undergraduate medicine and medical education in Sheffield. And we're very pleased to have enticed him down to Kenton Medway. And he's been key to some of those actions that I mentioned around broadening our demographic of entrants. And Dr. Scarpa Skuman is our head of assessment. He is a A&E doctor in one of our local trusts as well, and he's responsible for the more difficult aspect of being a medical student, which is sometimes it feels never-ending exams that we do subject you to. I've been through them, so has Anna, so has Philip, and they are, of course, essential to make sure that you're going to end up being safe and competent practitioners when you actually are responsible for patients' health and care. Next slide, please. You've seen the video of the Verena Holmes building at Christchurch University. So it's what we call a STEM building, Science, Technology, Health and Engineering. And that's really, really excellent because it means that when you come into that space, you won't just be studying in facilities that are for the medical school, but you'll also be in a space and able to learn about collaboration with other healthcare professionals, as well as other key individuals and potential future collaborators in the arenas of technology and engineering in particular. It includes specifically a high-fidelity simulation suite in the Anatomy Learning Centre. The Pears building is up at the University of Kent. And again, this is one of those advantages of being across two universities, because whilst you do have that collaborative and multi-professional space at Christchurch, in Pears you have a space that's solely for the medical school. And it contains the first GP simulation suite in Kent and Medway. It contains what we call a 3-in-1 seminar computer labs are used for. Next slide, please. So that's a very quick introduction to our medical school from me. You are going to get a lot more information over the course of the morning. I really hope that you find the morning interesting and stimulating and we meet all your needs. We had originally planned to spend some time answering some questions now. I'm not sure if Cameron and the team still feel we've got time for a few questions.
Thank you very much, Professor Holland. We do indeed have time for a few questions. We've also had a few more joiners with us from Milton Keynes, North London and Essex. Thank you all very much for joining. And Professor Holland, thank you very much for that little introduction there. You spoke a lot about the vision and the values of the school. It sounds obvious, and you did speak about it, but why is patient-centred learning so crucial to how the school is run?
So, patient-centeredness is at the heart of everything that every healthcare professional does. I'd like to believe that that's the case, and I genuinely do believe that. But if I can just give you an example of how the pandemic changed things. So in intensive care, we spend a lot of time looking after patients who are being kept in a drug-induced coma. They are on what you might call a life support machine, which is actually a selection of different machines doing a range of different things. And if you don't keep that vision of patient-centeredness, if you don't remember that it's a human being in the bed who has friends and family and loved ones who are caring for them and supporting them, then it can all too quickly mean that being an intensive care practitioner becomes a dehumanizing experience. So maintaining a constant perspective of patient-centeredness is essential. But over the past 18 months, we've not been able to let people come in to visit. And people have unfortunately died without having the benefit of their loved ones at their bedside, either in the lead up to that process or during the actual dying process. And again, that keeping in our minds that this is a person, that this person has a network and this person has a life that is, or maybe unfortunately, coming to an end. That's what keeps us human. That's what keeps our team grounded on why we're doing what we're doing. And that also reflects back to the sort of care and the professionalism that we reflect back to those people who are observing what we do and how we are. And that's elemental to every medical specialty and discipline, from intensive care right through to surgery and medicine and rheumatology, as well as general practice, community and mental health.
So incredibly vital. Now, from the person to the place, what can you tell us about Kent and Medway as a place?
So I moved to Kent and Medway shortly after getting this job. I live in the North Kent coast, looking out over the Thames. I previously was Deputy Dean at King's, which sends a lot of medical students on placements down to Kent and Medway. And whilst King's students definitely got if you like, a flavour of Kent and Medway, I did feel that they never really got the true Kent and Medway experience. Kent and Medway is a wonderful county. It's huge. It has one of the biggest populations and land sizes of any county in England. It's in the southeast, so it's close to London. It's also close to Europe. Allowed to travel. I've hopped on the train and gone to Lille and Paris since moving here before the pandemic. And it has these two wonderful universities and a simply beautiful cathedral town. So you've got all of that milieu, as well as a large population requiring healthcare. And that means that there's a large and an extensive healthcare infrastructure here. So it really doesn't matter what you want to do in terms of your future professional career, that opportunity will be there. Bringing a medical school into that environment means that those opportunities have only grown. So now you don't have the opportunity to choose almost any medical specialty that you might wish, but you now have the opportunity to blend that into a portfolio career that it might involve education, it might involve research, it might involve partnering up with an entrepreneurial, small and medium-sized or even international corporations such as Pfizer or GlaxoSmithKline Beecham, both of which have presences in the county. So if you really want that portfolio career in your future, Kent and Medway can now genuinely offer that in a beautiful environment in which to live and have your life.
And I was just going to ask you about that. You spoke a little bit about opportunities. Of course, at the end of the degree, students will be looking to go into the job market. And just as you touched on there, there really is a plethora of opportunities available in Kent and Medway.
Yes, there absolutely is. We have 4 excellent acute general trusts. We have one of the largest mental health trusts in the county. We have a huge opportunity to practice in a range of different practices in general practice and community medicine. And we also have voluntary and independent sector organisations and palliative care hospices, to name but one example. With the expansion of medical students that happened to result in 5 new medical schools, the country is expanding the number of what are called foundation program posts to make sure that those expanded medical graduate numbers have jobs to go to. In 2023, we'll have an additional 50 what are called foundation program posts, and by 2025, when our pioneer group will graduate, we'll have an additional 100 foundation program posts. So those jobs will be here in Kent and Medway. We really do hope that lots of you choose to stay. We also are completely open to the fact that some of you will want to go away and go somewhere else. We hope that you go away, go somewhere else, learn something, become expert in something, and bring that back to Kent and Medway. We genuinely think that the medical school, as I've just alluded to, will make the prospect of a career in Kent and Medway much more attractive than it even was before.
It does sound like an incredibly attractive proposition. Professor Holland, many thanks indeed. You'll be joining us a little later on to answer some questions, and all of you at home can send in any questions you have in the YouTube and Facebook live chat sidebars for Professor Holland and our many panellists to answer. We're getting a few coming in now, which we'll get into shortly. We have got another presentation coming up, but first, the school welcomed its first cohort of students last year, as you heard from Professor Holland. Here's a handful of them sharing with us what attracted them to Kmms and what they've enjoyed most in their inaugural year.
I thought it was a good course structure. I like the integrated course with the early clinical practice, the dissections.
What I really like about med school is I get to, in lesson of course, see all these illnesses and all these problems, and then when I'm put into placement, which you're going to do in your first year at GPs, you get to see the GP diagnose and you actually get to see the illnesses in real life, and it's really fascinating.
It was important to me to choose a school that was accessible from abroad because I come from France, and Canterbury was perfect for that. I also really appreciated the fact that Kmms was a very innovative school that I shared many values with.
I love the workload, I think. It's a lot, so it's got good and bad things about it, but I do really like to keep myself busy, and I found sort of it stimulates me in a good way.
So my favourite thing is probably how it's so hands-on, and we're able to apply the stuff that we learn in the lectures in settings like this, so in the clinical settings, and then we can go and put it into practice in our placements in the GP.
I think it sort of helps you shape the kind of person that you want to become, because you push yourself to limits that you didn't even know you could go to, and you meet tons of great people with the same mindset as you, which is really encouraging, and you learn lifelong skills, and it's just an amazing place to be, in my opinion.
I'm very pleased to now welcome Deputy Dean and Undergraduate Programme Director Dr Anna Amito and Lead for Assessment Dr Scarpa Skuman, both on the line. Dr Amito, thank you for joining us and the floor is now yours.
Thank you. Good morning, everybody. Thank you very much for having me here to explain a little bit more about the programme that we've got at Canterbury Medway Medical School. I know the Prof Holland has been talking a bit about the context in which you're going to be learning and some details of the programme already. I hope to provide you with a bit more information, but I'll keep it fairly light, and then if there are any further questions, we can have those at the end as well. So the things that I'm hoping to cover in this presentation is a bit about why are you learning what you're learning, what is it exactly that you're going to learn, and how is it exactly that you're going to learn. If we could go to the next slide, please. The first question is about why. Why am I learning this? And Prof Holland has already talked about the importance of patient-centeredness here. We recognise that what you're learning in medical school is what you need to prepare you for the careers that you're going to be having as doctors. And that in order to be safe and in order to be able to deliver the kind of care that your patients need and the kind of care that you would want to do as a good doctor, there are large parts of the curriculum that we need to be covering. But the main why of why you're learning this is because it will prepare you properly to be the kind of doctor that you want to be. If we move on to the next slide, the other reason why we are learning what you're learning is because we're driven by other external influences here, particularly from the General Medical Council. So the learning that you have is mapped to the General Medical Council's outcome for graduates to ensure that it's got all the different elements that you need for your degree to count, and it's also mapped to Brighton and Sussex Medical School as well. So what is being taught in that medical school is being pulled across. We're shaping it in the way that we think is appropriate for your learning, but they're linked to an existing medical school already. In terms of the content that you're going to be learning, the key things here are described, but there is obviously a lot more. I've just tried to put on the slide the titles and the headlines of the kind of things that you're going to be learning. We've described in your program some fundamental tracks, which is what is sort of summarized here. These are the sort of the building blocks that you're going to need. So you've got anatomy, biomedical sciences, things like physiology, pathology about different diseases, and pharmacology, how you're going to medically manage some of the conditions and issues that you're going to be seeing as practitioners. As mentioned already, we recognise that we're looking after the healthcare of people at an individual level, so we need to be able to do person-level healthcare. But we also need to understand things at a community level, and obviously the pandemic and the effects of that is a prime example of how we need to be looking after the population as a whole, and some of the decisions we make about healthcare are because we're thinking more than one individual, thinking about communities as a whole. We want to make sure that you develop the skills in scholarship so that you know how to look things up, you know how to find out things for your own careers. You develop the skills in terms of how do you inquire, how do you build upon the learning that we're giving you when you need to be doing some self-directed learning as well. How might you begin to develop the skills yourselves in becoming research active and contribute yourselves to the enhancement of medical care in your future careers? We recognise that you need to develop a number of clinical skills. So in the videos you've just seen some of our current students learning examination skills, learning consultation skills, how to talk with patients, how to find out what's going on for them and communicate back to them. Also within professional skills, the ability to work within a team that you might not necessarily have met before, a team that's got different backgrounds to yourselves, both in terms of their professional experiences, but also in terms of the kind of people that they are, and so on. And so I think your program will incorporate teaching on these elements so that when you're then in practice, you feel fully prepared. Obviously, we're working within the context of the law and the jurisdiction in which we practice, so we need to make sure that you've got a sound understanding of law and some of the ethics and morality around the decisions that you're going to be making as well. And in order to do that properly and to know how to look after our patients as people, we need to recognise human behaviour. What is it that's driving people to behave in particular ways or to experience things or interpret things in a particular way, and what underpins some of the actions that we ourselves take as practitioners. So you'll be learning that as well. There are some elements to the programme that are not summarised in this slide that we are referring to as vertical themes, and they include things that make our programme stand out a little bit more. So we've got particular emphasis on things like leadership and management and patient safety as just a few examples of that. You'll have your core program that will prepare you fully and comprehensively, and within your core program, there's opportunities that are described in the box at the bottom of the slide, like selected student components. And these are parts of your modules, and you have to do that part of your module, but you get to inform the topics and the areas that you look into. So you get to shape parts of your program to look at areas that are particularly interesting to you, or that might be relevant for the career that you anticipate that you're going to be having. That's true both within the program in terms of the student selected components and research projects that you're going to do, or the elective that you might do in year 5. But also there's the opportunity for an integrated degree. For those of you who aren't familiar with what that means, you can temporarily hold your medical school experience and you then take a year or so out where you'll go and do another degree in another topic before resuming your studies. So these are all different ways in which you can take the core program in a direction which is going to also represent the specific interests that you've got. We move on to the next slide, please. So this is an overview of what we're going to be learning as well. So here, and I hope that you can see on the slide clearly enough, this is a summary of the different modules that we've got. This is also available on our website. Got 5 years of your program on the assumption that we're not intercalating. And in those 5 years, you've got a program that is taking you from the very start of year 1 to the end of year 5 in what we're considering a spiral curriculum. So there are things you're doing in year 1 that you'll revisit at different points, potentially in year 2, in years 3, 4, and or 5, progressively building upon them in terms of complexity and detail, so that by the end of year 5, you've got all of that prepared. But year 1, year 2, year 3, year 4 are not irrelevant to get you there. It's all very much part of the journey. So you could look at any one part of year 1 and we'll be able to explain to you why that is relevant to prepare you for the last day of year 5 going on to your careers. In year 1, we've got a couple of modules that span the year, which are described at the top of that box there. These are modules that you will again build upon during the course of the year. One of them is things like placements, where you'll have placements early, come back to campus for a few weeks, back out on placement, back to campus for a few weeks, and so on across the year. You've got other modules that start for a period of time, typically between 8 to 11 weeks, and then they'll stop, and then you'll go on to the next module, and so on. And they're complementary with the modules that are running along the whole of the year. So, for example, if we take the middle one of year 1, heart, lung, and blood, this is where you're going to be learning about the cardiovascular system, the respiratory system, and blood hematological system. When you're learning that, in the skills in clinical practice module and in your community placement module, you're going to be learning how to examine those body systems at the same time, so that we've timetable things so that you're learning things in a logical sequence as much as possible. Year 2 follows a similar pattern, and then come year 3, you spend the majority of year 3 out on placement, with a little bit at the beginning of the year where you're on campus. Year 1 and year 2, you're spending most of your time on campus, with 6 and 7 weeks respectively on placement. Years 3, 4, and 5, that ratio changes. But what we mean by an integrated curriculum is that from the get-go, you're having that experience of both campus and placement-based learning. In year 3, you've got some long blocks of 15 weeks of medicine and the same of surgery, where you'll be spending the time on the wards understanding about patients' different departments within those specialties, and understanding the patient experience when they're in hospital. Year 1 and year 2 and the part of year 3 before you go out onto the wards will prepare you for thinking about how did patients get into hospital in the first place? What was done for them in the community in the first place? Who might they have contacted, depending upon their illness and how suddenly it happened, before they got to the point of being admitted to hospital? I know Holland has already mentioned that I'm a general practitioner, and we obviously have a large number of patient consults from which the patients don't go any further. But of course, a number of our patients will, during the course of their lifetime, have hospital experiences as well. And so by learning in year 1 and year 2 in primary care, and then in the hospital setting in year 3, and then a bit of both in year 4 and year 5, we're really hoping that you're going to understand the journey that your patients will take, independent of the career choices you make. You'll understand what else is happening in the healthcare system to support your patients. In year 4, you'll spend more time going through different rotations that are more specialist, for example, paediatrics, obstetrics and gynecology, rheumatology and dermatology, and so on. And again, you've got some time spent in community as well, recognising the fact that some care, for example, for paediatric patients will be taking place by GPs. Some of it will be the responsibility of paediatricians or other members of the paediatric team. And year 4 will help you understand and explore that a lot more. And in year 5, we revisit medicine and surgery. We also revisit mental health that you've been doing in year 3. There's also opportunity for general practice again, for electives, and there are finals as well. We're really seeing year 5 as being a sort of apprenticeship style year, so that come your day 1 of your postgraduate experiences, nothing comes as a shock, that you feel fully prepared and that you've built progressively upon your experiences as you go. Let's move on to the next slide, please. Okay, so this is a summary of how you're going to be learning. So there are lots of different styles that we would use at Kmms. So there are different types of teaching that we have, and some of them are going to be on campus and some of them are going to be off campus on placement. Some of them are going to be on your own, so they're self-directed learning. You'll be learning sometimes on your own as an individual, sometimes as part of a small group. The small group teaching that we organise within the school is typically between 6 to 9 students, one of those two. But obviously within your peer group you might want to have small groups that you set up for personal study. Some of your learning will be online and some of it will be face-to-face. The ratio that we've had of online to face-to-face in this last academic year has of course heavily been influenced by COVID. We always plan to have a degree of your programme online. We recognise that actually that gives you more flexibility in terms of where you live, in terms of how you organise your time and yourselves, and means that wherever your placement is will allow you to access core knowledge. We know that with online learning you need to have access to a device. As students you get a device provided as part of the programme, so that you've got a tablet, you've got an iPad that you can be studying. Like I mentioned, the ratio of online to face-to-face this year has been different from what we had predicated and what we would normally want to have going forwards. But we do anticipate that a number of your lectures will be going online, but we anticipate keeping face-to-face things like simulations, so hands-on skills training, your placement experiences as well, and your tutorial groups, and what we call team-based learning, which is larger groups of students coming together to learn some of the concepts that you've got in your lectures. With your lectures, we've been delivering them live or recorded. So again, if you really benefit from having the opportunity to interact with the lecturer and ask questions, you can do that. If you like the ability to have things played at a slower pace because you find it easier to listen to, or the opposite, you want it faster, listen to it once, then go back to it and press rewind and listen to some key concepts again, you absolutely have that choice. So again, we've tried to build in what we think is essential ways to learn for certain skills and development, and other areas where actually you can use some autonomy and you can be flexible depending upon what's going to work for you best. We use a mixture of lectures, tutorials, simulation, practicals, all the different things that are already described on this slide for you. And we recognise that within the use of all of these different activities, you're using different skills through inquiry, through practice, through discussion, to be able to develop your knowledge and your skills. Can we go to the next slide, please? Sorry, one back. Thank you. The slide that we've just got there, which is a picture of our students. These are examples of some of the experiences that our students are having at the moment. So there are some where our students have been on placement, some where they are based more around learning in more of a classroom setting. And this is just to give you a little bit of a flavour of some of the sort of diverse experiences that you might be getting when you come to Kmms. I hope that's been a helpful taster of the kind of things that you're going to be learning and how you're going to be learning, and some of the key things that we think are important between the presentation that you've had already from Prof. Holland and the detail that I've provided here. I'm now going to move over to Dr. Scarpa-Schumann, who has got further details that he's going to describe about the assessment strategy that we use within Kmms, which is clearly linked very much to your learning that you have and is going to be part of your learning experience. And then we're both going to be available for any questions that you have.
Thank you very much, Dr. Ramita. Good morning, everybody. It's lovely to meet all of you on this e-meeting strategy, and it's a privilege for me to just take you through some of the core aspects of our assessment process here at Kmms, which you know is going to be part of your life as a medical student, as Prof. Holland has already alluded to. I think all of us as doctors have gone through rigorous assessment to get that licensing process for us individually to practice medicine. Can we maybe go to the first slide, please? So at Kmms, in especially your first year, there's going to be a variety of modalities that we use to assess you. Some of the ones are mentioned on the screen here for year one in particular, and I'll just talk a little bit about each of them. The Applied Knowledge Tests, or AKTs, these are the knowledge tests for the learning you've done from a knowledge perspective and how to apply your knowledge. We use single best answers and very short answer questions in an online platform to assess those knowledge bits. We set the pass marks and to determine outcome for these particular assessments with particular systems. So the pass marks are not fixed, they are variable because we use standard setting methodologies to determine how difficult was the paper for year one students and then set the appropriate pass mark to maintain standards. You will also be doing some presentations, mostly in relating to your professional development module and your GP placement module. So there is a bit of assessment via presentations as well. Clinical skills assessments, or OSCEs, they stand for objectively structured clinical examinations, are small tasks you do to demonstrate the skills you've learned in the clinical skills space, how to take histories, how to examine some patients, how to do some basic procedures like dipping a urine or taking a blood pressure. So these are the skill sets we'll assess you with during the year and also at the end of the year to see if you're ready to progress from the skills you learn in year one. And every year during the program, we'll have an OSCE at the end of each of the years, up to year 5 before you graduate. There's also an essay to write in the first year and in the second year. That's part of your professional development module. And we also have a project report. You do a little project in your general practice module and placement, and you have to write a little report about that. Then the e-portfolio is a very important component where we measure attendance, engagement, and professionalism aspects, and that's part of every module and has to be passed to progress in the year. So these are just a flavor of the things you will encounter in your first year and the various types of assessment modalities we use. Next slide, please. So it's important to know that before you get summatively assessed, that means when the assessment counts for marks and pass and fail at the end of the year to progress to the next year, you will have opportunities for formative assessment, especially in the AKTs and the OSCEs, to give you a flavor of how those exams feel, how do the questions look, how to prepare yourself. These are mock exams. They don't count towards progression, but the data is used to try and identify students that are not thriving or are struggling. So we want to try and support students as best as we can. So there's always there's a principle of trying to give students a flavor of via a mock exam before they have to do the real big one where we make decisions about progression. So these are there to help and give you feedback on your learning and how to progress. Next one, please. So you've heard about the General Medical Council, which is the regulator of medical education in this country, and Kmms is also in the process of going through GMC regulation to get fully established when we graduate our first cohort. And it's part of the GMC's vision and mission of the GMC is to ensure that we are promoting excellence and patient safety at the heart of our program and definitely also at the heart of our assessment strategy, to ensure you guys are amazing doctors going through Kmms. So we've put in some innovative and some brave strategies, learning from the sector of happening in other medical schools and also at the literature to innovate and inform and move forward the scope and the skill sets and the advancements in medical education assessment. And we've implemented a few things here at Kmms. Let me start looking at the first one. Next slide, please. So if we look at what we do with resets, so if a student is unsuccessful, Kmms does not have traditional resets that you might see at a lot of other medical schools. So the traditional resit model is you sit the exam, you might fail it, you have to resit it in the summer, and then you can get an outcome to potentially pass. So we do not do that in years 1 to 4 in our applied knowledge tests or in our OSCEs. We use a process called sequential testing, where you have 2 opportunities during the academic year, but those 2 opportunities where you can score, get marks from a module are combined before we make a decision on progression. So if you do poorly in the first opportunity, you'll have to make it up in the second opportunity to pass the module. Or if you do very well in the first opportunity, you don't have to do as well in the second opportunity to pass the module. So the 2 opportunities are still there, but they are linked and together and during the year. No one has to come back in the summer for more exams. So that's the approach we take here, and there's been evidence that students who are doing a resit model sometimes continue to struggle in future years. And we are trying to make sure that our students remediate early and sort out any issues so that they can fly in the rest of the course and really excel towards the end of their studies. We also, as part of this process of sequential testing, of doing 2 sequence testing during the module, have called what we use and call fundamental track assessment. The fundamental tracks are the critical subject areas within the learning modules that are linked to the applied knowledge tests in particular, like anatomy, physiology, biomedicine, person and population health, to make sure that our students are fully rounded when they progress. So the fundamental tracks run in the background. We make sure that as we tag all the questions in the AKTs, we can analyze and see how students are doing in the subjects that are actually making up the integrated applied knowledge tests. So students don't have to pass all the fundamental tracks, but they shouldn't fail any of the big tracks, so that we make sure that our students don't have holes as they progress to the following years. We are all about gearing you guys to be very successful graduates and really doing very well in the General Medical Council's medical licensing assessment, the MLA, which is in final year, which is a national exam for all medical students wanting to graduate and get a license to practice in the United Kingdom. And it starts in the 2024-25 academic year. So our current first years will be in the first cohort writing the MLA exams at the end of final year. So we want to set our students up to excel in that final year exam, to really feel that they've got the confidence, as Dr. Amito said, to go out and practice with solid knowledge and skills and with the good attitudes, because their professionalism has been well developed and well managed. And I think we look forward to working with students. We've got a philosophy at Kmms to work closely with our students, give feedback, in support the students if they struggle. But we also need to promote excellence and patient safety. So maintaining standards is where assessment is very important, to make sure the students who are ready to progress do progress. But we hope that every student progresses. It's certainly our heart, but there are a lot of exams. And it's important to take note that when you come to any medical school, assessment is very much part of it. And we work with our students to try and optimize their performance. Thank you very much.
Thank you very much, Dr. Schoeman, for telling us a bit about assessments, and Dr. Amito, thank you very much for telling us a bit about the course. Now, we've got loads of questions coming in, so let's get stuck into them now. Dr. Amito, one for you from Yasmin. She said, what is the style of teaching like?
Thank you, Yasmin, for your question. So the teaching will vary depending upon the kind of modes that we've got. So we use lectures, particularly in years 1 and year 2. We also use what's called team-based learning, which is where you're in groups of 6, but in that group of 6, you're then working alongside other groups of 6. So in total, there are 54 of you in the room, where you're then working through questions, usually case-based example questions, which will allow you to apply what you've learned in the lectures that you just had to actual cases and make sure that you understand what it is that you should have been learning in the lecture. And that's done with either the lecturer themselves that delivered the lecture and with other members of staff from the year that you're working in. We've got tutorials, which are small groups, again, usually around 9, and the flavour of the tutorials is usually more around discussions or role plays, and depending upon what's being taught. So, for example, some of the medical humanities, ethics and law will be discursive learning, whereas if it's more around things like communication skills or clinical skills type tutorials, then there'll be opportunity for you to practice those skills. We mentioned already about some simulation, which is hands-on experience, so using models or using actors to be able to practice your skills. And we also use clinical placements where you're actually going out into the community or into the hospital and you are working alongside healthcare professionals, not all of whom are doctors, but we think that that's really important, that you learn to study and work alongside people who are not necessarily medics themselves, because that's the reality of what it'll be like when you're working. And you'll have opportunity then to be able to meet or speak with patients and use the skills that you're learning on campus to learn from them directly. So a variety of different modes, each of which is tailored to what it is that you need to be learning at that particular time.
A question also in from Jamie. He's saying, I'm looking to become a psychiatrist. Do you have facilities and content in the curriculum designed around psychiatry and mental health care, Dr. Ramito?
Yes, we absolutely do. I mentioned already that we've got sort of core learning, which will prepare you whatever type of program that you want to go into. And of course, after you graduate, there are a couple of years of, again, core postgraduate training at the foundation program before you choose a specialty. However, specifically within our program, I think Dr. Holland made reference to the areas, in particular in the workforce, where we recognise that people are interested or need to be interested in careers in that space, is primary care and mental health care. So we've got those specifically emphasised in the program. So in year one, we've got time spent in general practice. One of the examples that we'll work through in your placements in general practice, we'll be looking at, for example, feeling tired, which is sometimes a physical manifestation of a disease. Sometimes it can be because somebody's got issues with regards to their mood or their well-being or their health or stress levels. So already at that point, you're beginning to explore some areas of community-level mental health problems. That is then picked up again in year two, where we've got a module called Neuroscience and Behaviour that looks at common and serious mental health problems, as well as preventative approaches to that. So, for example, you'll learn about sleep and well-being and chronic stress, and the impact this has both on yourselves but also on patients that you might see. And again, in your placements in year two, we've got cases that would help you be exploring some of the kind of things regarding mental health that GPs see and support and deal with. In year three, you've got a long module that spans a whole year in psychiatry, where you'll be spending some time every week that you're doing medicine and surgery dedicated to spending time with the psychiatric teams and in different departments and learning about mental health problems. And again, this is picked up again in year five. You've got a further placement in acute psychiatry in year five. As a generalist myself, I just emphasise that your placements would involve any acute admissions, which is both year three and year five, and primary care, which is particularly in years 1, 2, 4 and 5, you will see mental health presenting in and amongst all of that as well. But there are both specific and more general opportunities for you to be learning about mental health.
Absolutely. Plenty of opportunities for you, Jamie, if you decide to come here. Dr. Schoeman, a question for you. What sort of support can students expect through assessments? Will there be lots of opportunities for contact hours with staff, for example?
Yes, we provide support for students by giving them detailed feedback, mostly numerical in the applied knowledge tests. Then we have a feedback meeting where we just discuss bits of the exam. And then myself and other colleagues are very available for any student who'd like to discuss individual bits about their exam or questions they didn't understand. We use a protected bank, so we can't share the questions out at this stage because we're building the bank, but we do allow students to have individual discussions on particular questions, and we can go through the questions with them if they're not sure about things. In clinical skills, the students have regular contact time practice. We talk about the exams and how the assessments work, and there's, as I mentioned, the formative exams, which really gives a crystal clear, I think, insight into how the exams look and feel and how the systems work, that we will run it in the actual summative exams, which count towards progression. So the other exams, the essays and the reports, the students have opportunities to do mock reports. They can get feedback on it, so they can do drafts, and then they do the formal submission. So there is always an opportunity to learn and get feedback before the big day of the big final exam.
Absolutely, lots of opportunities and lots of questions coming in about course and assessments. We'll get those answered a little bit later on. But Dr. Ramito and Dr. Schoeman, it's been great to have you on this morning. Now, as you've heard, placements are a key component of the course. Over the years, some of the students have been sharing their placement stories on social media. In this first clip, Tutor and Michael talk about their eye-opening and enjoyable experiences.
Hey guys, I'm Yuta and I'm going to be taking over the KMMS MedSup Instagram today. So today I'm with the GP. We usually take histories, do a couple of examinations, call up patients and things like that. So yeah, I'm excited to see what today has to offer. Right now I'm quickly going over the respiratory history and examinations because my GP loves to grill me, so I need to be on top of everything.
The best thing about GP is they really go above and beyond to teach you. We just learned respiratory examination by practicing on each other, and it's really nice to have some hands-on clinical experience.
Hey guys, so I'm back now from placement. I'm so tired, but it's been a great day. Yeah, so this afternoon we did the breast exam, outdoor exam, respiratory exam, like the whole thing, which was great. History taken as well, which is always fun. My highlight of the day was I got to use this bad boy for the first time. You know how it is. Yeah, it was just an all-around educational day. We got taught a lot, we learned a lot.
So earlier this week we were assisting at a COVID vaccination center. They're currently vaccinating priority group number 6, which is people between the ages of 16 and 65 who are at risk because of certain underlying conditions. So we're currently having lectures about the respiratory system, and there was a physician's associate at the practice who taught us the basics of auscultation within the context of a respiratory examination, and he was also really nice and allowed us to practice on him. So today we had 3 different patients come in with breathlessness, and we were able to examine their chest, and based on each of their histories and associated symptoms, we tried to come up with what we thought might be possible likely diagnoses, and we also tried to come up with a plan for each of them moving forward.
Kmms placement. We've got our first panel joining us now, and if you've got any questions about accommodation or student life, this is the time to send in your questions. We're going to start with Dr. Julia Hines' presentation. Julia's the academic lead for student life and wellbeing at Kmms. Dr. Hines, it's over to you.
Hello, and you are very, very welcome to this open day. So I would like to ask you, what would you see your medical school doing for you to assist you in your journey? I want you to keep that question in mind, because we're going to have a chance for discussion later in this section. So what would be the one thing you would like your medical school to offer to help you succeed? It could be various things. So if we go to the next slide. What are you most concerned about starting a medical degree? You could be worried about various things, or you could be worried about a specific thing. You could be worried about having a disability, and we will be able to assist you with your journey regardless of what your worry is. Next slide, please. Because student life and wellbeing is a protocol that will assist you in various different avenues of your academic life, but also in your student life and with regard to your physical well-being and your mental well-being. So we do offer you a friendly, supportive and a private facility if you need help. We have practical information and advice, and we have clear signposting to wider resources, and we will look at that later in the slide. So you will have access to student life and wellbeing wherever you are, whether you're on campus or whether you're on your placement. Next slide, please. So we want you to prepare for each step of the journey, and we'll be there to assist you to do that. And in order to do that, we'll identify when you need assistance. We'll identify what we call transition points. A transition point would be, for example, you're transitioning from your A levels, and I am aware that you will not set your A levels this year, and that can be a major transition going from A level to university study. When you're at medical school, you will transition from going from first year to second year. And within first year, you'll transition from going to the campus to your clinical placements. So in that space, we will help you to reflect on your experiences, and we will have a warm and welcoming, inclusive environment, both on campus and in your clinical placement. The next slide, please. So what specialist support do we organise? Well, within student life and wellbeing at Kent and Kmms, we offer assistance with everyday problems. For example, you can call in and have an appointment with a student support advisor. If you need more specialist help, then we will direct you to Kent Specialist Services. So Kmms is there to help you recognise and triage what support you would actually need. Within Kent and within Kmms, we also have the personal academic tutor system. So what would that be? That would be that each student has a PAT, and a PAT is an academic that will assist you throughout your studies from year one right through to graduation. And that assistance will take the form of academic assistance. It could be help for transitioning into placements. And then if you need other assistance, then that can be another way to triage what assistance you need. So if we look at our specialist support that we receive from Kent University, next slide please, we will see that there is, for example, low-level intervention and counselling. There's CBT, cognitive behavioural therapy. There are the disability services. So I want to concentrate on disability just for a moment. At Kmms, we believe that a disability should not stand in the way of you achieving equal opportunity and learning and developing to your potential within education, within the medical school. So a disability does not have to be an obstacle to stand in the way between you and your dreams. Indeed, it should be viewed as a strength, because if you have a disability or have had a chronic illness throughout your life, you will have a unique perspective on illness. And with your future patients, you will be able to bestow the wisdom that you have learnt in dealing with your own disability. So you will not only be able to sympathise, but you will also be able to empathise with your patients. And in that sense, you'll be offering a truly patient-centred approach. You will know what it feels like to be vulnerable, and the patient that you will have in front of you will also feel vulnerable. So you'll know exactly how that patient feels, and you will know that trust is a very important part of the patient-doctor relationship. When we are vulnerable, when we are sick, we are very dependent. As Alistair MacIntyre, one of the great philosophers of today, said, we are dependent animals. And it's only up to us, in part, how we proceed. It's over to our doctors, to our nurses, to our teachers, of how we develop to our full potential. And at Kmms, we will be there to support you if you do happen to have a disability or a chronic health condition. Next slide, please. So Kmms works with partners. We work under the umbrella of the two universities, Canterbury, Christchurch, and the University of Kent. And we are uniquely based in that sense because you will have access to both student unions. You'll be able to enjoy all the different activities that the student unions offer, but not only the student unions, but we also have a MedSoc Society. And the MedSoc Society will be there to assist you in all the different activities you want to get involved in. So I will hand over to our MedSoc representative now.
Hello everyone, my name is Rachel. It's so nice to meet you all. I hope you're all enjoying your open day so far. So I'm just here to talk to you a bit about MedSoc. So MedSoc is pretty much the student society here at Kmms, but we are actually part of the student union at both Christchurch and Kent. So being part of MedSoc not only puts you in a really big Kmms family, as so does being a student here at Kmms, but it also enables you to get involved with a whole lot of clubs, activities and societies at both Christchurch and Kent as well. So I think there's like over 200 clubs and societies that you can join. Like there's actually a whole plethora of things that you can get involved in. So some of the things I chose to get involved in were archery, it was, fencing, and literally anything that was fun and I hadn't tried before I pretty much signed up for. So in terms of MedSoc, completely student-led, made up of, elected cohort representatives. And yeah, you just, you have to do your hustings, so you apply and, the whole cohort vote, and it's kind of really fun. I actually was lucky enough to be elected as the BAME officer as well as the social sec. So if you're looking forward to freshers, we have stuff planned for you. Our President Mary, she kind of looks over and makes sure that MedSoc runs smoothly. We liaise both with the faculty as well as other organisations such as the BMA and the MDU and other universities that have medical school. So yeah, when you, hopefully if you want to join Kmms, which we hope you do, MedSoc is something that is really beneficial and most universities have it. And yeah, it's a great place to get involved, meet like-minded people and really grow and explore yourself here at uni.
Absolutely. We're going to ask about some more of those societies and those opportunities. We have had a few questions in, but finally, let's head over to Katie Latchford, Senior Accommodation and Conferences Manager at Canterbury Christchurch University. Katie, it's over to you.
Hello and welcome. I'm going to try and be quite brief because I know there's been a lot of information given to you this morning. I'm here representing both Kent and Christchurch accommodation teams because actually we work very closely together for our Kmms students. And you're able to choose whether you want to live in Canterbury Christchurch accommodation, which are those two slides on the right, or University of Kent accommodation on their campus, which are those slides on the left. We have two different price points for you, one at a value level and one at a premium level. And the key difference between those is room size, but also whether you're happy sharing bathroom facilities. And both of those, all of the options that we have, whether they be at a more value level or a premium level, will be living with other Kmms students in clusters. So the cluster flats range from a small cluster of 3 up to larger clusters of 8. And I think I'd probably rather answer any questions that people have. So that's probably it from me.
Well, lovely stuff, and that's a perfect segue. We have got a question in for you, Katie, from the Beaton family. They've asked, do medical students live alongside non-medics?
So medical students will live in flats with other medics, but those flats are in larger blocks and areas alongside other students from different courses. At Christchurch, we obviously have a large cohort of allied health profession students. So we normally try and block placement students with other placement students, just so that we don't impact by way of life.
And in terms of the accommodation offered, you touched on it a little bit there. What are some of the major differences between the various types of accommodation that is on offer?
I mean, I think that the price is the same, whether you live on Christchurch accommodation or at the University of Kent, as is the licence length. I think it really comes down to your preference on whether you want to live in the middle of Canterbury or slightly outside on a greener campus. The actual accommodation themselves are very, very similar. So it really comes down to preference. And I feel like it's a really great thing to be able to choose what kind of first year accommodation experience you want, campus based or in the middle of what is a really vibrant student city.
And like you said, it's really that experience is what you make of it. We've had a question from Naomi. Rachel, you're probably best placed to answer this. How easy is it to balance medical school and partaking in society? You mentioned archery as one example just then.
Oh, well, thank you so much for your question. Just to answer that, I would say it all comes down to your time management. So as well as being part of archery, I do fencing, salsa, hockey, I get involved with MedSoc, and I also have a job. So as long as you're good at managing your time, like the sky's your limit. So it's pretty easy to get involved. You just sign up. There's going to be a freshers fair, so there's plenty of opportunities to see what's out there. And yeah, anything that takes your fancy, and of course, you can accommodate with time, because study's first. Yeah, just get involved.
And the £1 million question, obviously, you balancing all of those things and juggling all of it. Any tips to some of those students who are going to be coming to Kmms on how best to time manage and balance all of these activities as well as their studies?
Yeah, let me reel through my mind and see if I have any tips. Yes, I do. Tips, of course, med school is, a time-consuming course, so put that as your first priority, because, that's what we're here to do. So for me, I kind of figured out in the first term how long things were taking me, how I learned best, what free time I actually did have. And then the rest of it, after I got my work done, I was free to, play hockey or do this or do that. But just figure out how much time you have left after you get your work done and then plan it accordingly.
Some words of wisdom there. Dr. Hines, we're going to come to you in just a sec with a couple of questions. But Katie, we've had a couple more coming in about accommodation, asking, is accommodation guaranteed for the first year?
Yes, so we guarantee accommodation for all first year Kmms students. We would like people to apply by the 31st of July. And that is where the guarantee is on our web pages, but we didn't not place anyone last year who came to us later. We also have a clearing guarantee, so I would suggest, we placed everybody last year who wanted accommodation with either university. And I think everyone got their first choice as well.
Well, that's going to put those prospective students at ease. Emanuela's also sent in a question. Do you have to live on campus, or is there private accommodation options?
Yeah, there are private accommodation options. Canterbury's got a large number now of private purpose-built student accommodation blocks, which are very good. There's also a lot of kind of on-street houses in areas of Canterbury that students are able to live in. So yes, we have information on both sets of web pages, which will help you choose a good landlord if you're looking at private let. But no, you don't have to live with us.
Absolutely. And a final one for you, Katie. Is there self-catering and en-suite options? And are there common rooms and shared social facilities in the various accommodations?
Yeah, so the premium accommodation is en-suite, but you will be sharing kitchens and living spaces in that. Our value accommodation, you'll be sharing living spaces and kitchens, but also bathroom facilities. All of that is offered as self-catering as the first option, and you're then able to buy, if you choose to, a meal plan that goes alongside your accommodation. So that is your choice. If you want catered accommodation, that is available, but all of the accommodation primarily is self-catered.
Dr. Hines, question for you. The mental and physical well-being of students is obviously crucial to their student experience, to how they get on at university. How is that ensured through the likes of the union and student services and through Kmms?
Well, if a particular student has a particular health dilemma, we would triage it at Kent and Medway Medical School, and we would ascertain what would be the best platform for the student to flourish. So, for example, the student may require counselling, low-level intervention, or cognitive behavioural therapy, or may simply need to go to see their GP. But in addition to all of these services, we would encourage students to get involved in activities so as they have a work-life balance. And each week we have a little student newsletter, and in that newsletter we would point towards all different activities that are happening. In the PAT meetings, the personal academic tutor meetings, the tutors will keep up to date with the students and how are they managing their work-life balance. And if they see something amiss that the student perhaps could benefit from more support, they would point them in the direction of the particular support that they would benefit from.
There we go. The tech gremlins were back again. Sorry about that. Dr. Hines, got just a follow-up question as well. You're talking about collaboration earlier. Can students get involved in enhancing the experience of their fellow students at the university?
Yes, absolutely. We have a peer mentoring service also. And a peer mentoring service entails that they can't, our students at Kmms are paired up with pharmacy students currently. And it means that both sets of students can learn from their individual experiences. So if the pharmacy students are more advanced and have been at the university longer, then they will be able to perhaps bestow all the tidbits of wisdom they've learned. But equally, our medical students, a large proportion of them are graduates themselves. So they come to the programme with a lot of wisdom in higher education, but wisdom also in life and how to deal with different scenarios in, developing a good work-life balance. And it would mean that the peer mentors will be able to provide a listening ear and support to their fellow students. If you listen to Rachel today, our MedTalk representative, you will see that Rachel, has much wisdom and would put students at ease having a chat. So that's the way the mentoring service works.
Thank you all very much for your insight and for answering all these fantastic questions that are coming in, and do keep them coming in at home. Rachel, you're going to be sticking around for a little bit to answer a few more, and we'll be talking about admissions and be joined by another student shortly. But first, here's another look at the state-of-the-art facilities on offer at the Kent and Medway Medical School, with a look inside the Pears building just before the first cohort of students arrived. And as you'll see, various social distancing measures like tape were on the seats, and here we are to have a little look inside the Pears building. Quite a stunning building. Now let's introduce our second panel. This time we've got a couple of students, including Rachel, who we'll have back on the line shortly, and admissions lead Dr. Philip Chan to answer any questions you have at home. Dr. Chan, I believe you got a little presentation for us, so it's over to you.
Hello, yes. Thanks very much, and again, welcome to our virtual open day. We're really happy to see you. Now, many of you obviously are looking into applying for and ultimately attending our medical school, and I just want to put you into my shoes for a moment in terms of admission to medical school. We all know that there are many, many, many more applicants than there are places for medicine. And Kent and Medway Medical School have one of the highest applicant ratios in the country at about 15 to 1. Selecting the right candidates for our medical school, though, is full of problems. And that's because medicine is academically demanding, and it's absolutely chock-a-block with exams, not just in medical school, but lots of exams afterwards when you are actually in specialist training. And that means, therefore, that selection tends to lean towards exams with success. However, if we just pick out the people that do the best in exams, whatever they may be, whether they be A-levels or UCAT or whatever exams, then that biases our intake towards good schools, essentially, towards the selective state schools and towards strong private schools. And that then reinforces the types of inequalities that we have in our society. And there are some facts, really, about the inequalities in medical admissions. And I hope you can see them. But what it shows that even now, we're strongly biased towards a certain sector of our population in terms of selection for medicine. And that is the most economically privileged. The graph shows a comparison in orange between the most economically privileged and in blue, the least economically privileged parts of our society in terms of who gets admitted to which course. And as you see, there are inequities in every university level course, but they are more pronounced in medicine than in anything else, presumably because medicine is more competitive than anything else. We're not happy with this situation. We're not happy that half of all schools in the UK don't even produce a single applicant to medicine. And we do feel that many potentially strong young people are being disadvantaged in terms of their chances of entering the profession. So our approach, next slide please, is that Kent and Medway will operate these various policies. We operate minimum standards for entry, and that includes GCSE, if that is what you have, A-levels is what you present with, and we have a UCAT threshold, which we'll come to in a minute. We don't use predicted grades at all. So therefore, we don't even look at what you're predicted if you're a pre-A-level student. But that also means that if you are an undergraduate student, we won't look at your class prediction, your bachelor's degree. Our standard conditional offer is lower than almost any other school in the UK, right? Except for two others. And our standard conditional offer is AAB. We do not, however, give a lower or a discounted offer than that, except to our partner schools here in Kent. And even then, we don't give a lower offer to every applicant from those schools. We, however, look at contextual admissions, but we look at contextual admissions in a different way to everybody else in the country. And I'll explain that in just 2 slides, right, after I ask you this question. Next slide, please. Now, let's try and simplify medical school entry to a single exam. Right? It's just a concept. And I'm going to ask you to vote in your in the chat for 2 candidates. Right? The single exam is the medical schools have got together and say the pass mark for that exam is 70. So if you get 70, you can go to medical school. However, it's very competitive. And so the average entrant to medical school has a score of 75. I've now got 2 candidates, and I'd like you to vote for one. Right? Candidate A has a score of 70, and candidate B has a score of 75. But candidate A and candidate B have very different backstories. So candidate A comes from a school which is in difficulties and has failed its recent Ofsted inspection where the maths teacher is trying to teach chemistry, and their average score on the medical school entry exam is actually only 50. And they've not had anybody enter medicine in 10 years. Candidate B comes from exactly the kind of school that I would like to send my children to, where the school has an excellent record, superb teaching, wonderful facilities, and manages to get an average score on this medical entrance exam of 80. So candidate B has a score of 75, which is below the school average, but it's actually higher than candidate A's score. So in the chat, if you wouldn't mind, I'd like you to vote, please. And could you please vote for either candidate A or for candidate B? Next slide, please. So at the moment, I can't actually see your votes, right? So, but if you are like virtually all the other open day attendants, you've voted, the majority of you have voted for candidate A. And our job at Kmms is to put in place a set of policies that allow us to admit candidate A over candidate B, because most medical schools will do it the other way around. And the ways in which we do it is called contextualize everyone. That means dividing our applicants into 4 groups. A pre-A-level group, right, are contextualized by comparing their GCSE results to their school average GCSE. The post-A-level groups are also school leaver age, and we can compare their A-level results to the school average and completely ignore the rest. If you're a pre-graduate but has not yet graduated, and then because we don't look at predicted grades, we'll look at your A-level grades, because they are the senior achieved grade. If you have already graduated, we find it difficult to contextualize you, And we're using a number of methods, including a scoring system. And last year, we actually used an online situational judgment test, a video situational judgment test called Casper, which is now being rolled out as a trial to all 5 of the new medical schools. And of course, there's always a group of miscellaneous who don't fit any of these categories. And we're afraid we have to do that the old-fashioned way by looking at subjective factors. There are very few people in that group. So we have, as a result of this, a very friendly shortlist to widening participation candidates. And we have almost double the number of widening participation candidates than normal for the sector. And we never ask anybody if they're widening participation. So we'll never ask you whether your parents went to university, whether you're in receipt of free school meals, or any of the other things that are commonly asked in the sector, because we don't worry about that. We just contextualise you according to your educational attainment. Next slide, please. So we have a stage process, and essentially every time you pass one stage, everybody that's passed is all equal again. And then they go through the next stage, and then you're all equal again, and so on and so forth, until finally the last stage is you're either offered a place or you're not. Stage 1 is for minimum requirements, and they're all in our prospectus on the website. And again, it depends which of the 4 groups you're in, what the minimum requirements is. Stage 2A, everybody has to sit the UCAT exam. Our threshold in 2020 was the 44th centile, so it's quite a generous threshold. For graduate applicants, it was the 47th centile, so hardly any different. Stage 2B, I've just described to you, is contextualisation against your school average if you're a school leaver, and by complicated methods if you're a graduate. And stage 3 is the interview. We only invited 400 people from our nearly 1,500 applicants last year for interview. And our interview is by multiple mini-interview. It is planned to be 7 stages. This had to be cut down last year because of COVID. And we always prefer to do that in person. That's what we're planning for this year's entry. But it might not be possible. We may have to revert back to virtual delivery depending on the public health situation. But we always would want to do it in person. And our MMIs, I think it's fair to say, you can confirm this with our students, it's kind of different to other medical schools MMIs. And we don't recommend preparation, we don't recommend rehearsal. These things are possibly disadvantageous to our MMI because we're really seeking more what kind of a person you are rather than whether you've prepared the right answer. Last slide, please. Oh, sorry, second to last. So what we're looking for is that we want to admit students who are high achieving in context, who are motivated, who are resilient, who are committed to these kinds of NHS values that are illustrated, and are basically fantastic human beings. We are impressed by what you've done, what you've actually achieved. We are less impressed by what you say you might have done or you would have done. Last slide, please. So, happy to take questions. There's always a ton of these questions on Open Day. I also know that one of the features that everybody values at Open Day is a chance to talk to me person to person. And that is possible because we will run a post-Open Day Teams meeting. To access that, please email this email address and we'll give you a link to an appointment where I'll keep you in the waiting room in an orderly queue until I'm ready to speak to the next person. But very happy to take that. It's the equivalent of the queue that forms to speak to me outside of the lecture theatre on an Open Day. Yeah, so very good to see you, and I hope you understood that. I'm very happy to take some questions now.
Fantastic. Thank you very much, Dr. Chan. And interesting to see all students, all prospective students, I should say, voting for candidate A earlier on during your presentation. As you said, a ton of questions always come in on the subject of admissions. So let's get cracking with those. Sanborn has sent one in saying, what's the limitation on the number of students internationally? Do you provide scholarships for them?
We have up to 8 places for international medical students. We do not have any scholarships dedicated specifically for international students, but international students, if eligible, are welcome to apply for any of the other scholarships if they meet the conditions.
And we've had 2 people asking pretty much the same question, Mohammed and Adiba. In terms of work experience, is that required beforehand getting into Kmms?
Well, I think work experience is really sensible for people who are contemplating a career in medicine, because it's one of those careers in which reality is really very different from how the career is portrayed in the media. So it's really important. However, as far as being able to document and boast about what kind of wonderful work experience that you've done, that is kind of less important, I think. It's not always possible to access the very medical or hospital-based types of work experience. We do value a lot of different types of experience. It's also very difficult for us to verify. And so it doesn't count any particular points in terms of your application. But I do read your personal statement if you are close to the borderline of any of those stages that I've previously described.
You're talking about it being quite difficult in some scenarios to get that work experience. Something that Adiba said in her in their question about, obviously COVID-19 restrictions have made it very difficult to do in-person work experience. So obviously hearing what you're saying there, that's not the be-all, end-all for them. They've taken some virtual experience, so that's obviously something that could be in their favour.
Yeah, I think the virtual experiences are good, but I think that we still value personal qualities that are demonstrated by in-person work experience, which needn't necessarily be in the medical sector. It could be in the care sector, it could be paid employment, it could be dealing with the public, it could be all kinds of things that will demonstrate things about you.
Absolutely, and as we've got Rachel still around from earlier on, and Inshira's joined us as well. Inshira, tell us a little bit about what your journey to med school was like.
So I'm an undergraduate, so I just came through from my A-levels. So it was a bit of a jump because I just come through from lockdown to medical school. But I think one of the things that Kmms did really well was making sure that they transitioned us very smoothly. So it wasn't intense from the beginning. They made sure to ease us into it, and I feel like that really helped me coming into medical school. So yeah, I did my A-levels and I came to med school.
And preparing for the UCAT, Inshira, how did you go about doing that?
So I think for the UCAT, I think my advice would be just practice, and making sure that you actually identify your weaknesses. Because for me, abstract reasoning was one of the things that I really hated. And most of the time, you normally do the things that are easier for you. So for me, situational judgment was easier. But I think tackling the things that are hardest and making sure that you actually get on top of it will really help, and a lot of practice too.
And Rachel, you were talking earlier on about really getting engaged and engrossed in that student life experience. But let's kind of go back a little bit. How did you end up choosing Kmms over obviously other med schools that you could have gone to?
Well, how did I choose Kmms? So basically when I came to Kmms, I'm someone who likes to ask a lot of questions. So prior to coming to my interview, I was on the phone to Kmms asking questions left, right and centre, like what about this and what about this? And luckily, every single time I called, someone answered the phone and gave me a clear-cut answer. And it was just from even prior to my admission, the continued support and clarity I really appreciated, because sometimes when you call people up, they have, 500 other students calling, and they're less likely to give you the time that you want to clarify, your points and to kind of put your mind at rest. But Kmms I found very supportive, very clear cut, and you could just see that people actually cared and they wanted you to succeed. And I thought to myself, hey, this looks like an environment where, it's not just in your best interest to succeed, it's in their best interest as well. So imagine the magic that can happen as a result.
And you're coming to the end of your first year. What's and obviously it's been difficult because of COVID, but from what you've been able to gauge, what's Kent and Medway, the place, been like?
Oh, so I came from London and I was somewhat reluctant to leave because I love it quite a lot. And I was planning to commute, but then, I thought to myself, Rachel, medicine is time intensive. I'm a night owl, so I like to study at night in the library. And I was like, Rachel, you're not going to be able to do that and then get a train home because the trains aren't going to be there. So I decided to move. And I was surprised pleasantly because it has everything that I need. It had everything that from shops to cinemas to, food places. I mean, I'm Nigerian and they even had a place where I could get Nigerian food. So I was like, okay, it's not all bad. And it's been a really pleasant experience moving here. So I really enjoy it here.
That's really, really good to hear. And I'm sure we're going to hear a little bit more about your experiences in our final panel shortly. As I said, Dr. Chan, loads of questions coming in about admissions, and we'll touch on them in our final panel. Just one more before we go into a short break. You've given obviously a really holistic look at the admissions process and the sort of things that you're looking for in students. Bringing that all into summary, Adiba's asked, what is Kmms looking for from prospective applicants?
Yeah, there was a slide for it, and if you remember, the last bit of the slide is that we really want you to be a fantastic person, and we want you to show us what makes you a fantastic person. Obviously, you have to meet various academic and grades and things of this kind. But in the end, I think it's the non-academic parts of the requirement that are going to predominate, because that is what's going to be tested at the time of the MMI. And yes, Kmms is unique in having a group station as one of the 7 stations as well, which all our students will fondly remember.
Lots of questions, more to come there. Dr. Chan and Inshira, you're going to be sticking around to answer those. But now let's check back in with some of that first cohort of students, this time to find out what they love most about the wonderful city of Canterbury.
My favourite thing about Canterbury is how it's so diverse in terms of you've got the countryside right on your doorstep, and then you've got the city right on your doorstep as well. Which is really nice.
I really like the people in the area. It's quite a diverse set of characters and there's quite a lot of green too, especially now in summer.
It sort of feels homely to me, like it's so calming and sort of accessible. You can so easily get into town from the uni. There's so many things to do.
I think it has a great balance between sort of the calm, relaxing aspect, so you get to live in a place where there's loads of nature and you can just walk around and feel really relaxed and take a break from studying. But at the same time, there's some really great places to sort of go hang out with your friends on a Friday night and enjoy yourself.
What I like about Canterbury is how lively it is and all of the parks that you get to walk into and the shops, and it's a great walking town essentially. And it's great when the weather is nice and the sun comes out. The people also come out, and I love that.
We get our Wednesday afternoons off on our timetable, and I normally use that to play some sort of sport, or if I've finished my work, I normally go socialise with other housemates.
I recently joined Netball Society, so I've been going to that every week. It's a really good way just to get out the stress and relax. I also play a bit of piano.
I have really good housemates and I found a really good group of friends, so we go out into town a lot. There's tons of great parks to sit in, there's cafes, and libraries to go to, and there's a lot of really nice places that are just sort of a drive, like a really short drive away. So you can go to the beach, you can get the train to London for the weekend if you want. Yeah, there's loads of things to do.
We're nearing the end of today's virtual open day. Still got loads of questions to go through. But first of all, a big thanks, of course, to Rachel and Inshira for coming on. They're in the middle of doing their final exams at the moment for first year and have just been on placement. So, Inshira, let's come to you first to tell us a little bit about what your first year has been like.
So my first year, it's been okay. It's been a bit different, obviously, because of the pandemic, but I feel like Kmms have been able to really tailor our needs and tailor our experiences to what's going on. But I think one of the highlights definitely have been placement, because most of our stuff has been virtual. So being able to go out into the community and be able to use the skills that we've developed online through learning virtual examinations and various other techniques that we can actually use at placement has just been really great. And that's one of the reasons why I also chose Kmms as well, was because of the early placements that we have earlier on. So able to actually talk to patients and actually be able to use our medical knowledge was something that I really enjoyed. So, yeah.
And tell us a little bit about those experiences on the placements. Where are some of the places you've been? What are some of the experiences you've had?
So I just had my final week yesterday, which was really great, and it was just nice to spend with patients, talking to them about their various experiences in their healthcare profession, also being able to take histories from patients, being able to perform examinations on patients as well, as we've been assessed to do that on placement. And also it's been really great to see my growth from week 1 to week 6. Being able to see the knowledge that I've accumulated over those 6 weeks have been really fantastic. So yeah, placement has been a really good opportunity and something that really stood out to me when applying for Kmms.
Professor Holland, we've had a few course-related questions coming in. Naomi and a few others actually asking, does the programme have opportunities to study abroad, electives, or work with partnership universities?
Yes, we do. So we've got a couple of ways in which we can offer you that opportunity. We do, as a programme, offer the opportunity to intercalate. So that's taking a year out of your studies to do something else. This is something that's fairly unique to the British medical system, but we have just, we're offering that opportunity after year 3 to do an intercalated bachelor's degree, or after year 4 to do an intercalated master's or even a MD or PhD. The PhD, of course, will take 3 years, not 1. We wanted to make sure that our intercalation menu of options speaks to what we as a medical school can offer and also what the 2 universities can offer. But we also wanted to make sure that it was relevant to contemporary medical students. So we haven't set that in stone, and we've just had our first town hall meeting with our group of pioneer medical students. First of all, to tell them what intercalation is all about, because not everyone knows that, but then also to start the conversation around what sort of intercalation options would you like us to do. I would just mention that the market, as it were, for intercalation options is changing, and some of the drivers for why students might want to intercalate are changing. As of this year, the organisation that manages application and allocation of foundation programs is no longer giving additional points for intercalation degrees. They're recognising that education attainment in different ways, and all medical schools are expecting that this is going to drive down the interest that students have in intercalating. That doesn't to say it's not a worthwhile opportunity still, but we've yet to see what's happening in the market regarding that. We will, of course, support students going to other universities and medical schools to intercalate. And as I mentioned, mostly that will be British universities, because 1 year curtailed degrees at bachelor level are not common in other medical education systems. However, for those that don't want to intercalate, within the fourth year of the project, the fourth year of the program, we have an individual research project. This is something that Brighton Sussex medical students do, and it definitely will make sure that you graduate with above average, shall we say, competencies, insights, and knowledge and achievements in that arena of research and scholarly activity. Turning now to electives, after your summative final exams, the AKT and the OSCE component, after those exams around about Easter in final year, that's when our elective module happens. That's 4 weeks of elective. Electives have not been happening over the past academic year, obviously because of pandemics. By the time we get to the 24-25 academic year, hopefully we'll be in whatever the new normal is, but we have yet to see what will happen with electives, because it's safe to say that electives have definitely moved closer to home than they were historically over the past 18 months.
And Inshira talked in glowing terms there about her placement experiences, and we've had a question in from Ria, Professor Holland. Do students get paid during their placements?
No. In some other healthcare professions, that is something that happens, nursing in particular. But nursing students have to do a certain number of placement hours, right down to the actual number of hours. And that's in order to graduate. And one of the ways in which they encourage those nursing students to get a broad range of, in particular, time in placement is by giving them a notional pay. Medical students, it's seen differently. Your placement is part of your study, and so you don't get paid while you're doing that. I would say that we, for placement, it's probably been mentioned elsewhere in the morning, but for placements that are far away from Canterbury, we do ensure that the placement provider provides accommodation. And in years 3, 4, and 5, when you're on placement, we're working towards being able to arrange for you to not need to have a term time address in Canterbury for the whole of the year. If you wish to not do that, if you, for example, are placed in Tunbridge Wells Hospital in Pembrey.
We've had a contextualisation question come in for you, Dr. Chan. They've asked, I'm in a pre-A-level group for admissions. Would you look at my secondary school or my sixth form for contextualisation?
Yeah, if you present with at pre-A level, because we don't look at predicted grades, we would not look at your sixth form achievements. So you would present with GCSEs. We would then contextualise the GCSEs to the school that you took your GCSEs in, not in your current sixth form college.
And Professor Holland, a couple more course-related questions. How guided is the learning? Is there a specification that is given to students?
Sorry, I'm just organising my thoughts, and it'd be really interesting to hear how this is actually played out in real life in terms of the student experience. I would hope that we provide a lot of scaffolding, although that I would say that is also conditional on the fact that coming out to university, we expect any university student to become a lot more independent and self-directed. So the program is specified. We have learning outcomes, and each learning opportunity that you have, be that a lecture, a seminar, an online event, or a placement, has specific learning outcomes attached to that. And we obviously give you support in the form of reading lists and guidance to other resources that will help you go more broadly and more deeply into a topic. But you will find, and every university student finds, that the step up from the A-level experience to university experience does require more self-direction and autonomy.
And that kind of feeds into another question we've got in from Chidinma. They've asked, how many contact hours would students have per week?
So relative to other programs, medicine does have a lot of contact hours. We have quite a busy timetable, and Dr. Ramita described that earlier. So you'll find that the majority of your Monday to Friday apart from Wednesday afternoons, which is generally sacrosanct so that students can partake in sports and clubs and societies and other things. You will find that the majority of that time is timetabled. Not 100% of it. There are scheduled times for self-directed learning, and there are scheduled times which are just free because of the small group nature of our teaching. You might not be being taught and have contact time while someone else in a different cohort is.
For Nshira, we've had another question sent in from Emanuela. She said, considering the fact that we'll be on placement, do you think students can balance the course, placement and finding a job all at the same time?
We do have, obviously, Wednesday afternoons off, and as Professor Chris Holland has said, there are opportunities in the day where there are free times for us. So if you're not in a session, you can be doing self-directed learning or doing something else. So there are definitely times to balance all the opportunities and hobbies that you have during the day.
Back to you, Professor Holland, with a couple of quick questions. Mariella has asked, how is Kmms when it comes to research? Would it make sense for someone that wants to go into research to apply to the school?
I would definitely say that the answer to that question is yes. We're not UCL, Imperial, King's, Oxford, Cambridge. We're not that sort of medical school. We are a brand new medical school and we are starting the research endeavour. However, we have started to make research appointments, and there is a lot of research both in biosciences and in healthcare, both medical and other professions and disciplines happening across both universities and across the region already. Within the programme, you start off with opportunities outside of the core learning of the programme. You have compulsory but student choice opportunities called SSCs. In year 4, you have the independent research project, and then you have these options to take a year out and do other degrees. So there's definitely the opportunity there, and lots of people looking forward to working with students to make sure that you not only get those generic academic and scholarly opportunities, but you do have the opportunity to actually engage with research and produce research output before you graduate.
And sticking with you, Professor Holland, and do excuse my ignorance, I'm not sure what the acronym is for here, but they said, what differentiates Kmms from BSMS? How is the course different?
Okay, so I'm assuming that BSMS is Brighton and Sussex Medical School. I'm going to go into a little bit of detail about the accreditation process of a new medical school. This is outlined on our website and on the GMC, the General Medical Council website as well. Every new medical school is required to have what's called a contingency school, and I mentioned that BSMS is our contingency school. Now, one of the reasons that the contingency school is there is so that if the new school, for whatever, fails to live up to the GMC's requirements, the students in that new school, what's called novate, that is transfer across onto the contingency school's program. Now, they don't physically move, they stay where they are, but the contingency school steps in and takes over, and that cohort of students ultimately graduates not from the new school, but with a degree awarded by the contingency school. Now, we hope that that's not going to happen, and as Dean, I am very expectant that that will not happen. We have a good relationship with both the GMC and our contingency school, but because of that need to have that safety net of novation, it does mean that our assessments need to be lined up with Brighton and Sussex's assessments, so that if novation happened, you could transfer across to schools without needing to do any catch-up, summer school or anything like that. We would hope that that wouldn't be necessary. Now, outside of that very, very hard requirement, what we test and the level at which we test it at matches Brighton and Sussex. Outside of that, we have quite a high degree of freedom to teach that how we want to do it, and in the sequence that we want to do it. And I would say that whilst broadly speaking you'll see similarities, you will also see differences. Dr. Ramito also mentioned how we've individualized. So we've definitely found scope within the program to, we feel, differentiate ourselves from Brighton and Sussex, so that, for example, throughout the 5 years of our program, you get a bigger and a better and a richer opportunity to understand things like leadership, innovation, entrepreneurialism, management, medical humanities, etc., etc. And these are the vertical themes that Dr. Ramito alluded to earlier. So certainly if you look at the two programs on paper, you'll see similarities, you'll see modules with similar names, but once you, and there are reasons why that is the way it is, that are mostly to do with Novation and the GMC accreditation process. But scratch the surface, I think that if you went to one school and you went to another school, you'd have a very different experience.
And Inshira, another question for you about placements. This coming in from the Beaton family. They've said, do students need a car to get to placements? Obviously, I'm not aware of your own travel situation. So maybe a more general one about what you found it's been like travelling for your placements.
So I don't think a car is necessary to travel to placement. There are public transport links, but also previously mentioned, you can apply for accommodation. So for this week, I applied for accommodation where I was staying, and that made the journey much shorter. So there are ways around. If you don't have a car, that's not a problem at all. The way the placements are made are to make sure that there are transport links that you can actually attend placement. And there's also accommodation that you can apply for as well.
Dr. Chan, quite an interesting one here. Would someone coming from a privileged background be disadvantaged in a sense in terms of the selection process?
Yeah, we would try very hard not to disadvantage any group of students. So if you come from a privileged background, you'll also be judged according to your background. So if you outperform your school average, whatever school that is, then that counts the same as if you outperform your school average from a less high achieving school. So it's just a question really of what background you come from and how much above that background you have risen.
Last couple of questions. Professor Holland, to what extent have you added clinical teaching to the course?
I would say that particularly in years 1 and 2, we've added quite a lot of clinical teaching. We mentioned the number of weeks of placement. So in year 1, you've got 6 weeks of placement, and in year 2, you've got a total of 7 weeks of placement, 13 weeks of placement in the first 2 years of the program. We certainly think that is one of the most one of the biggest amounts of placement times in the UK undergraduate medical programs, if not the most. Most medical schools, to a greater or lesser degree, certainly from year 3 onwards of a 5-year program, would say that their years 3, 4 and 5 are all predominantly clinical, and that's the case for us. The difference with our clinical years 3, 4 and 5 is that our placements are organised under the principles of what are called longitudinal integrated placements. And so that means that whilst, yes, you do have a lot of time in clinical placement, we've really thought long and hard on how to make sure that that is integrated and stable, so that you are in the same clinical placement side for all of each academic year. You're not moving around every 6 weeks, for example, as happens in some other programs.
Many thanks to Mohammed for sending in that question. Dr. Chan, another one for you. What factors make a good personal statement?
Yeah, we actually run sessions on this, and there's quite a lot of online advice. What I'd be looking for if I was reading your personal statement, and I read hundreds every year, is I'd be listening for your voice. And so I would pay attention to the content, but I'd try and find out from the way it's written what kind of a person you are, what are your priorities, what you're proud of, what you're less proud of. And so it's kind of pretty difficult to do that in a few paragraphs. But that's what I'm looking for, really, is your authentic voice. What kind of a person you are. The problem, I guess, these days is that most people write their personal statements according to a set formula. So one personal statement doesn't look that different to another. So it can be so try and put some personal touches in, please, for my sake, if not for yours.
Absolutely. And Shira, a final one over to you, quite a broad one. What is being a medical student like?
I think being a medical student is learning something new every day. It's not just about the learning something scientific new every day. That's something that's also interesting, but also socially, as a medical student, especially at Kmms, learning something new about people every day and the way that people interact and the way that people react to certain situations. So I think summing it up, being a medical student is learning something new every day, and that's something that is enhanced when you come to Kmms as well, through our placements and also through the way our course works. So that's how I'd summarise it.
Professor Holland, a final word over to you. We've heard about everything the course has to offer, everything the place has to offer. To bring it all full circle, what is special about Kmms?
So I would say that Kmms is special because of the people and the team. And I include not just the medical school team, but the two universities, because we really do believe passionately in that vision, mission and values that I outlined at the beginning. I really do think that when you come to Kmms, you're joining a family that's passionate not just about you and your educational journey, but making sure that at the end of that, you do become a competent and a safe practitioner in the discipline or specialty or area of interest that you want to be in, with the skill set to really take advantage of the opportunities that the next 50 years or so of healthcare are going to offer. And you do that in a person-centered way that's collaborative and respectful of all members of the team that you work with.
Well, a great place to end, and that's about all we've got time for this afternoon. My thanks to Professor Holland, Dr. Chan and Shira, and all our panellists this morning for taking part. But most of all, thanks to you at home for sending in all your fantastic questions. Hopefully, we've been able to answer them. If you want to find out more, you can go to www.kmms.ac.uk, email admissions@kmms.ac.uk, or follow the handle KMMS Med School on social media. There's also an opportunity to speak with Dr. Chan this afternoon for one-on-one virtual meetings to discuss your personal application questions. We'll have the details on how to apply to those on screen very shortly. But that's all from me. Thanks for watching this Kent and Medway Medical School Virtual Open Day, and we hope to see you here in 2022. Goodbye.